Kogi Doctor reportedly S from Lassa Fever A medical doctor with the Federal Medical Center Lokoja Kogi State, Ahmed Victor, who tested positive to Lassa Fever has D of the disease. The medical doctor, who described Lassa fever as a zoonotic disease spread by rats, stressed that personal hygiene or any measure taken to get rid of rats would help contain the disease. This followed the of a child in the early hours of Friday. The source revealed that the doctor did not make it. Ahmed contracted the virus in the line of duty and was transferred to Lokoja State for treatment. Our correspondent also learned that others, suspected to have had contact with the baby, particularly his parents, had been quarantined. The meeting, which was attended by 171 delegates from 53 chapters in the country, recommended the establishment of medical universities by the federal government to enhance the funding and capacity for undergraduates' medical training and allied courses in the country, which, according to them, will improve the doctor-population ratio and impact positively on healthcare delivery in Nigeria. He said the victim's blood sample was sent to the FMC, Lokoja State, where it tested positive to Lassa fever. The chief medical director disclosed that the 30-year-old male doctor was diagnosed of the disease on January 19, 2018. The director further disclosed that World Health Organization, WHO, the State Ministry of Health and other stakeholders have received information on the issue and are already on the ground to provide necessary assistance to the center. Meanwhile, a medical doctor who was said to have had contact with the deceased patient is now sick. Alabi also relayed that the center would commence health education of its staff to guide against human-to-human transmission of the disease. He said, the general public should endeavor to quickly report any case of high-grade fever not responding to anti-malarial treatment to the nearest hospital, so that quick diagnosis and treatment can be instituted. He also appealed residents to take urgent steps to eliminate rats in the houses and surroundings, adding that foodstuffs like gari, rice, beans and maize should be kept in closed containers to prevent contamination by rats.